Hello there. My name's Sarah. Pleased to meet you. And you are? That's perfect. That's who I was waiting for. Make yourself comfortable. How are you today? Good, that's fabulous. So, according to the notes I have, you're interested in the anti-aging skin rejuvenation acupuncture treatment? Yeah? Okay. And where did you hear about this? Okay, on our website. Yeah, okay. And may I ask your age? Oh. Have you tried any anti-aging treatments before? Just creams. Okay. Did they work for you? All right. Okay. And which ones did you use? You can't remember. Okay. That's fine. Have you ever had any skin problems on your face? Acne, eczema, dermatitis, anything like that? No? Well, you've been lucky. Okay. That's perfect. Okay. So, acupuncture-wise, have you had acupuncture anywhere at all on your body before? No? Okay. Yes, it can be very helpful in balancing the body and treating many conditions, yeah? But for your face, it can actually stimulate collagen and blood flow, which can help reduce the appearance of fine lines and make the skin look so much more healthier and toned. Yeah? Many people use it as an alternative to things like Botox and little lift treatments. Okay. Botox does have more of a dramatic effect, but obviously not everybody wants those type of injectable treatments. Yeah. Okay. Not for you. Okay. That's perfect. So do you have any health conditions that I should be aware of? Okay. So you just get headaches now and again, alright. And they're caused by tension, okay. Alright. That's common too. Do you take any medications regularly or ad hoc? Just paracetamol with the headaches, okay. So you're very healthy there then. Alright. Okay. That's wonderful. Okay. So what I'd like to do is take a little close look at your face, if that's all right. Yeah? Okay. I'll just pop some gloves on first. Do you know anyone that's had this treatment before? Oh, your friend. Oh, they come here. Who are they? Oh, yes. Yes, I do their treatments. It's nice to know. Nice of them to refer as well. Okay, so I just want to wipe your face gently, okay? Got some special wipes here. And these won't sting or burn. It's just to remove any residual dirt on the skin, which we can easily pick up from just being outside on our way here. Okay, so I'll just come in a little bit closer if that's okay. I'll just gently wipe around. Okay, there we go. Just gently wipe. Okay, across the bottom. And at the top. That feel good? Yeah, super. Okay. And just quickly down your nose. There we go. There. Right, so I'm just going to come in close and just take a look at your skin. Alright, do you have any particular areas of concern? Okay, so some fine lines around the eyes and on the forehead. Yeah? Okay, and the 11s there. Yeah, that's a common problem. Okay, so just relax. I'm just going to take a little look around your face. Okay. Just examining the skin around the eye there. And on this side. Just taking a look at that skin. It's very delicate skin around the eyes. And it's where, when we smile, those crow's feet and lines start to appear. And that actually starts to happen from quite a young age. And obviously as we lose our elasticity in our skin and the collagen starts to not produce as well, that's when more deeper lines can start to appear. Okay, let's just have a look at the top there. Okay. Just look at the top. Just a little look just under the chin area. Okay. Just going to do a little pinch. Well, on that inspection I can see that your skin is actually very healthy. Okay, you don't have any problems with acne or scars that I can see. Okay, you're right, you've just got some very fine lines around the eyes. They're not that deep. Okay, just a little area on both sides here that I can insert a needle into. Okay, which will help produce a little bit more collagen around these areas. Okay, and across the forehead. Alright, just across there. And I can do those 11s as well. Okay. So, this is an acupuncture needle. Okay, this is the locator there. And that is the needle. And it's very, very fine. It's not painful. You might feel a tiny pinch as they go in, and then I have to give them a little twist to locate them properly. Okay, but it's very, very quick. Insertion is just a couple of taps. Yeah. And I think what I will do, I'll just be placing some across there. Okay, here, and just around here. Okay. And on the chin, there. Okay, there won't be too many needles. Yeah, and you'll be so relaxed. Yeah. You're not needle phobic, are you? No, that's okay. Alright, so you just relax there and I'll just get everything ready and then we'll begin. Okay. start by taking the first needle out very gently. There's a little tab I just have to remove. Okay, so the first ones I'm going to do are across the forehead, so you keep nice and still for me. Okay, this won't hurt, you just might feel just a little pinch when it goes in. Alright, nice and still, thank you. Okay, alright, and okay, good. And there we go. How does that feel? Yeah, is that good? Good. That's perfect. Just going to give that a little twirl round. Can you feel that? Yeah. That's one. That wasn't so bad, was it? Okay, nice and still again for me. Thank you. There we go. Just a little twirl around. Okay, just at the top there, that's good. Okay. Just one more there. Okay. There we go. Alright. You okay there? Good, good, good. Perfect. You've done really well there. Little twirl. There. Just put a couple where your 11s are. It's just the look of the draw. Some people tend to get those lines, some people don't, despite they might frown a lot. It just happens, so don't worry, it's just one of those things. And yours aren't really too prominent anyway, but it's good to treat them before they do get prominent. Okay, alright, nice and still for me. Okay. Just tap that in there. There. Perfect. Just give that a little twirl round. There. Okay. Just one more there. Twizzle round. There, is that okay for you? Good. Right, just get another pack. Okay. All good. Okay, just going to put one into the side of your face, okay? Nice and still for me. Thank you. Pop that in there. And there we go. Little twiddle. There. You feeling all right? Good. I love doing this. I find it really relaxing. Okay, I'm going to do the same on your left side now. Okay, and position there, and give it a twirl. And I'm just going to do down here. Alright. Nice and still for me, thank you. Okay, little twiddle. Perfect. Okay. On this side now. Wonderful. You're doing great. Okay. And I'm just going to pop this one into your chin. Okay. Alright. Perfect. Keep nice and still for me. Thank you. There. How's that? Good. Good, good. That's perfect. It's in place. Right. So, how is that feeling? Good, good. You look fine. I'll just check around them. Right. I'll leave you for a few minutes if that's okay. Just to let them work their magic. Okay. Right. How are those feeling? Good. Well, I'm going to give them a little twiddle and then I'll remove them. Okay. Alright, nice and still for me. Okay. There's one. You comfortable? Good, good. Sometimes you could get a little spot of bleeding, but it's not very common. I'll clean it if it happens anyway, because I will clean all the area anyway. Okay. Perfect. How does that feel now? Yeah? And you feel really relaxed? Good. That's what I like to hear. Okay, just down here. Okay, and just the one on your chin. Alright, there we go. Perfect. Got it. Right then, let's have a little look at you. Okay. That looks amazing. Absolutely amazing. It looks all refreshed and there's a different tone to the skin already, and looks much more healthier just around the eye area, which is perfect. Okay, right. I'm going to give you a little wipe off again. Where the needles have been. They're not bleeding now, it's absolutely fine. Just down there. Okay. And just across this side. Okay. And on your chin. You're looking amazing. Do you feel okay in yourself? Good, good. Well, you just relax there for a while, okay? And I'll get your next appointment sorted out. Shall we see you in 4 weeks? Yeah? We'll get a couple of treatments in. Maybe 2 or 3 treatments, yeah, in the next month or so, yeah? Maybe 4 to 6 weeks, and then you can normally drop down to a monthly top-up, but see how you feel and see how happy you are with the results. Yeah? Okay, let me just see. Yeah, I can fit you in 4 weeks today. Is that okay? Yeah? Good, okay. That's perfect. Make a note of that on there and then we'll get you a card written out. Alright, okay. So, there's no rush for you to go. You just want to relax for a little while. But everything's looking fine and I look forward to seeing you again in 4 weeks' time. Alright, take care. Oh, hello there. Welcome to the spa today. Make yourself nice and comfortable there. You feeling good? Fabulous. Yes, it's nice and warm in here, isn't it? It's really cold outside. Yeah, let me just check what we're doing for you today. Okay, so it's a lip and chin wax today. Alright. Have you had that procedure done before? Okay. So you've had a leg wax before, okay? Well, it's a very similar procedure, but obviously on a slightly more delicate area, particularly on the lip. But you'll be fine, okay? Did you have any reactions before when you had a leg wax? Just a little bit red afterwards? Yeah, okay, right. Let me just make sure I've got everything ready here. The wax pot is on, so that's good. What I'd like to do first though is just have a little cleanse of your skin, if I may, okay, because we want all the oils and debris to be removed off your skin before we do anything, okay. So I'll just put my gloves on here. Alright, and we'll have a little cleanse around, and then I'll have a close look at your skin to make sure there's not any sore lesions or anything unusual which might cause a problem with the waxing today, okay? I've got some beautiful refreshing wipes here. Okay. Do you normally have sensitive skin on your face? Okay, that's good. Well, these are for sensitive skin anyway, but let's just give you a little cleanse. So just relax there, and I'll just gently move around your face and give you a nice little cleanse. Feels lovely, doesn't it? Smells good too. Do you wear makeup often? Okay, not much in the way of foundation, alright, because it can actually clog up the pores quite badly, and so we want to make sure that there's no residue there. Okay, let's just go a little bit underneath. How does that feel? Good. Could you just close your eyes for me? Thank you. Obviously I'm not going to be waxing your eyelids, but I just want to cleanse everything off while I can. Okay. And just underneath your eyes a little bit. Okay. That's good. I use these every day. They're a really good way to wake up as well if you're feeling a bit tired. They sort of really refresh you. Okay. Well, you've got no makeup on today, have you? I can tell because nothing's come off. Your skin actually looks really clean and clear. Do you get any problems with oily skin? Maybe just a little bit on your nose, the T section. That's a very, very common area. Okay. Right. I think we're almost done. Alright, just a little bit down your nose. Okay. Alrighty. So let's just pop that there a second. Right, so I'm just going to have a close look around your skin if that's okay. Alright. I'll just be very gently touching your face, okay? Just going to come in closer to you. Alright, let's just have a look around the side. Okay. It looks very good. I can't see any problems at the moment. Let's just have a look on that chin area. Okay. Just close your eyes again for me. Right, just have a little look down there. That's looking good, just across your forehead. Okay. Right. That seems fine. Well, before we start with the slightly more uncomfortable thing, I'm going to light a nice candle. So I've got a choice. I'll let you choose. These are brand new, and the spa was gifted these from Village Wax Melts, and they are beautiful. What lovely gifts. Just so nice. This is one of two that I've got. This is wood, sage and sea salt. So would you like to have a smell of that? Isn't that beautiful? And the other one I have is lime, basil and mandarin, and that's so gorgeous too. Yeah. So, what do you think? Wood sage and sea salt, or lime, basil and mandarin? You'd like the wood sage? That's absolutely fine. That's so beautiful. And you can get some of these candles and other products from our receptionist if you're interested. Okay, and just ask on the way out. So let me just get this lit and let's get some lovely smells into the room and some lovely relaxing sounds of the woodwick candle. There we go. Beautiful. Listen to that. The gentle crackling sound of the woodwick. I absolutely love that sound. So gorgeous and relaxing. So I'll just set that down and we'll let those beautiful aromas of wood sage and sea salt fill the room. Okay, so for the procedure I'll just be applying the wax to this area here because you don't have any in the centre there, okay, on that philtrum area, but you just have a very, very little bit of fine hair just on that upper lip, okay, and your chin, again, just very, very fine hair, alright. So I'll apply the wax, which will feel rather warm, okay, then I'll remove it with a quick movement, okay, just be a very quick movement, but I'll talk you through it as we go along. Okay, so how's your skin feeling now? Good, good. Right, let me just get things ready. I've had the wax pot on for quite a while, so I'm just going to make sure that that's at the right temperature. Let's just check that. That's looking good. Can you smell the candle now? Here we go. I'll bring it a bit closer for you again so you can smell it. So good. And sounds amazing. Okay. Before we start, I just want to check that you've got no allergies to anything that you're aware of. Okay. You've not had any allergic reactions to any other products before that you've put on your face? No? Okay, that's good. Just like to check these things. I mean, wax is usually okay for most people, yeah? But obviously if you've had it before on your legs, hopefully it's okay on your face, although this can be a little bit more sensitive. Yeah? So are you ready? Okay, right. I'll just gather everything together and we'll begin. Okay, so if you're ready there, I am too. So get some of that wax on. Just keep nice and still for me. I'll just do this side first. Okay, I'm just going to pop that on. There we go. Just get a wax strip. Okay, can you just pop your tongue under that area? Like that? That's perfect, thank you. Okay, just going to put that on. Smooth it down. Okay, and ready? There we go. Perfect. Let's do the other side. Okay. And could you just pop your tongue like that? Okay. I know it looks a bit silly, but not to worry. Seen it many times. Okay, so let me just get the wax strip and just press that down. Okay. And there we go. Only hurts for a second, doesn't it? Okay. So let me just put some pressure on that now for you. There. Is that okay? Good. Let's just have a look now. That's good. Okay. Similar procedure with the chin. I'll just apply the wax. Okay. And then I'll pop the strip on. Okay. And then just quickly remove it. I just need to get a slightly bigger piece of strip. Right, so I'm going to apply the wax in a downward motion on your chin, like that. Okay. Just going to support your chin. Okay, I'll press that strip on. Press that down. And I'm going to pull upwards with this, okay? There we go. Just check that. Alright, and here we go. Just going to the centre part of your chin now. Okay, just going to pop that on. Just down there. Okay. Another strip, and just support your chin, press that down on your chin, and there we go, just like that. I'm just going to do a little bit on this side now, alright, and then you'll be done. Apply that there. And just get the strip, support there, press that down. And 1, 2, 3, done. All good. Let me just check that now. Sometimes we get a few little straggly bits that won't come out, some stubborn ones, so I'll just have a little look at that one. Is that okay? Good. Just one little bit there. And I don't think you need anything plucking on your upper lip there. That's all good. Let me just have a little close look. Just checking closer. Just checking closer. That's all good. That's perfect. So how does that feel for you? Good. It's starting to smell really lovely in here now, isn't it? Yeah. Okay. Right, I've got some very, very special cooling cream, okay, that I'm going to pop on there. It's very, very normal to get that red look about you, you know, the redness, the erythema of the skin. It's very, very normal after waxing, but it will subside very shortly, usually within an hour or so. If you do get any unusual reaction or itchy swells, do let me know. But I'm going to pop some of this lovely soothing moisturiser on, and that will make it feel a lot cooler straight away. Okay. So I'm going to use these little cotton pads and just going to pop some of the moisturiser on. Okay. It smells lovely too. I've got lots of lovely smells going on today. Okay. just going to gently wipe it down onto your upper lip, and you'll feel that starting to be a lot cooler. Yeah, it's lovely, isn't it? There we go. Alright. Okay. So let's put some on that chin now. It actually doesn't look too red. Some people just tend to react more than others. Some look quite red, some barely noticeable. Yeah. Make sure I got some of that nicely on there. Super. Right, here we go. And I'm just going to pop this all over your chin. There we go. You like the sound of the candle? Yes, it's beautiful, isn't it? So relaxing. That lovely crackling sound. I love them. There we go. How's that feeling for you? Good, good. Gently just wipe that down onto your chin. There we go. Okay. Let's just smooth that down. Well, that's looking absolutely fine. Yes, of course, you can always book in for another waxing. It shouldn't grow back any darker now. No, we don't make new hairs grow by doing this. Sometimes when you've had a hair removed, you think it's looking more when it's coming back. It's just because you've got used to it not being there for a while. But it won't grow back any thicker than what it already is. It won't grow back any darker than it already is. Okay, in fact yours was very fair, but it won't come back any darker. Okay. And it depends on the individual. It also depends on where the hair is in the growth cycle as to how quickly it will come back. Yeah. I mean, you're probably going to not see much regrowth for a couple of weeks there. Okay. But we do need it a certain length before we wax it anyway. So if it just starts to poke through, obviously we can't wax that then. Just let it grow a little bit longer again, so there's something for the strips to grab onto, okay, and remove. Okay, same as what you do when you have your legs waxed. You need to let the hairs grow for a while before you do that. Okay. Well, I'm very, very happy with that. Oh, it's your birthday. Okay. So you're treating yourself, and why not? Okay, well, I've got some other things here that were very kindly gifted to me by Village Wax Melts as well. And I'm going to give some to you for a little birthday treat, because you've been such a wonderful client. And I've got these beautiful wax melts. Can you see those there? Beautiful heart-shaped melts. And these are in the scent called Olympia. There we go, have a smell of that. Do you like that? Yeah. It's really lovely. So I'll let you take those away as a little gift from the spa for your birthday. Okay? There you go. Super. Okay. So, let me just double check all that is all good to go. Yeah. Really happy. Are you happy with the way it's feeling? It's not feeling itchy or anything unusual like that? Okay. Try and leave makeup off your face. I know you don't tend to wear a lot, but do try to leave it off for as long as possible. Yeah. Just to let that settle down. And always make sure that you cleanse your face properly when you do have makeup on as well. I mean, your skin is absolutely beautiful. You know, you don't seem to have any evidence of acne or any comedones, blackheads, anything like that. It's very beautiful. I'm very envious. But, you know, just keep it as it is. You're doing obviously the right things. The skin looks very, very supple, nicely plump, doesn't look dehydrated. Do you drink a lot of water? Yeah, okay. Well, that reflects in your skin as well. So, if you'd like to book in for anything else at reception on your way out, please do that. Okay, and if you'd like to purchase any of those, the receptionist does have a few things that you can purchase. Okay, of the candles, etc. Alright, well, I hope to see you again soon. It's been a pleasure today. Alright, enjoy the rest of your day. Take care. Bye bye.